female gonadal functions and ovarian reserve in patients with acromegaly, experience from a single tertiary center. Via International Journal of Basic and Clinical Endocrinology. Abstract. Purpose: to evaluate the gonadal functions and related factors in female patients with acromegaly at the time of diagnosis, the course of gonadal dysfunctions and pregnancies during the follow-up period, and the investigation of ovarian reserve with serum anti-Mullerian hormone, AMH, levels in patients with reproductive age. Methods: patients who were not menopausal at the time of acromegaly diagnosis, N equals 47, were included in this study. Baseline gonadal status was evaluated retrospectively. Patients were divided into 3 groups: normal gonadal function, Group 1, gonadal dysfunction without central hypogonadism, Group 2, and central hypogonadism, Group 3. Group 1 and Group 2 were compared in terms of clinical and laboratory findings. AMH levels were studied in patients who were less than or equal to 45 years old, N equals 14, at the time of the study. Data related to pregnancies, N equals 13, were evaluated retrospectively. Results: Group 1 included 18 patients, 38%, Group 2 included 18 patients, 38%, and Group 3 included 11 patients, 24%. The estimated duration of acromegaly was longer, and baseline PRL levels were higher, in Group 2 than Group 1, P equals 0.002 and P equals 0.015, respectively. Gonadal functions recovered in 66% of patients. AMH levels were low in 64% of patients. The frequency of maternal diabetes and hypertension was 7.7%. And there was no tumoral growth in any of the pregnancies. Conclusion: the most important factors affecting gonadal functions, excluding central hypogonadism, are hyperprolactinemia and the duration of the indolent period before diagnosis of acromegaly. AMH levels in the majority of patients were found to be lower than the expected age. Despite the decreased ovarian reserve, fertilization and normal birth can be achieved with careful surveillance.